Hello and welcome. My name is Dr. Deborah Pinels. I serve as a forensic consultant for SMI Advisor. Additionally, I serve as the director of the program in psychiatry, law, and ethics, and as an adjunct clinical professor of psychiatry at the University of Michigan Medical School. I am a senior medical and forensic advisor for the National Association of State Mental Health Program Directors, and I have been working in carceral settings for many years of my career, and especially at the interface of behavioral health and criminal legal systems. With me today, I have some wonderful colleagues, and I would like to introduce you to Dr. Irina King and Dr. Beesh Jain. They will be sharing information about sticky situations they have faced when caring for those with serious mental illness, or SMI, in correctional settings. Dr. Irina King is a forensically trained psychiatrist who currently works as a correctional psychiatrist at the King County Correctional Facility in downtown Seattle. In addition, she conducts civil and forensic evaluations as part of her forensic private practice. Dr. Beesh Jain is board certified in psychiatry, forensic psychiatry, and consultation liaison psychiatry. He is the statewide medical director for the New York State Office of Mental Health's Division of Forensic Services and is an assistant clinical professor of psychiatry at Columbia University. Dr. Jain currently serves as counselor for the American Academy of Psychiatry and the Law and served as president for the Midwest chapter of APPLE, that organization. Thank you so much today for joining me to discuss your history of working in correctional settings as psychiatrists treating patients with serious mental illness. These facilities are vital for providing care, and we appreciate your eagerness to present your information about tricky situations that you have been in and how you handled them to help others who might face similar encounters. So let me start with Dr. King. Working in a correctional environment can obviously be complicated. Can you describe a situation that was somewhat sticky or challenging from a treatment perspective?
Sure. And again, thank you so much, Dr. Finals, for the introduction and this opportunity. And indeed, working in the correctional setting could be quite challenging. And after having worked in such a setting for about 3 years, I've encountered a lot of situations that seem to be extremely challenging. And I think the one that I would like to talk about is when we have a patient who is in isolation and has a history of mental illness. But at the time, the patient refuses to eat, refuses to engage with staff and engage in any kind of assessment. And I think the difficulty is that because of staff shortages, specifically in the correctional area, often we don't have access to care or access to a patient. So let's say my initial treatment plan includes assessing the patient and see what's going on with the patient physically, mentally. But because there is now a DEC officer to provide access to the patient, so what happens, we cannot get vital signs, we cannot assess how much the patient eats or drinks, and then it leaves us with somebody who might be medically and psychiatrically unstable, but we don't have any means to get access to the patient. And what we're left to do is to monitor the patient through the door or through the window. And then at some point, we are forced to send a patient to a hospital if we don't have access to check their vital signs or to know for sure how much the patient has eaten or consumed water or liquid over a certain period of time.
That's a really tricky situation, and all the more reason that these kind of settings need excellent clinicians to help identify when hospitalization may be required. Dr. Jain, do you have an experience that you can share of a complicated situation that was sticky or challenging from a treatment perspective?
Yes, thank you so much for having me. And one situation that comes to my mind is I was asked to do a competency to stand trial evaluation in a more rural jail setting. And this was a setting where I had been to previously only a few times. But when I came to the setting, found out that actually the correctional officers weren't aware that I was going to be coming. And so immediately they set up a makeshift space so that I could do the interview of the evaluee. And when I started doing the evaluation, the evaluee became agitated very quickly, was very paranoid, and very disorganized. So I immediately had called for the correctional officer to step in and assist and escort the individual back to his cell. And that situation brought up a number of different issues. One, it was a new jail setting for me. So it reminded me of making sure that we're talking to the correctional officers, talking to whoever's setting up the evaluation, to have provisions for the appropriate space to do an interview, safety precautions in place. It also brought up a tricky issue about, we suspected that the individual may had also been using some substances illicitly while in the jail. So it brought up the issue of how do we report contraband to both the treatment providers and the correctional officers, and having a provision in place so that they can do appropriate testing and appropriate searches. Each institution may have different policies regarding that. And also I was concerned about immediate treatment needs for this individual. So we had to work with the nursing staff and the treatment providers to make sure that this individual gets treatment. And so it spoke to just the coordination of care that goes into correctional environments, making sure that we're aware of who's available for security and safety measures, who's available for treatment, how to access that care, and also building good relationships with our correctional colleagues and all the people who are involved. So that one case, while it's a case that wasn't particularly dramatic in that sense, but it did bring up a lot of these unique issues and served as an important reminder.
Dr. King, hearing Dr. Jain's answer and thinking about your situations that you've been in, are there strategies that you wanted to outline that you used to help you get through, for example, that individual, the individuals you've seen who aren't eating or drinking?
I completely agree with Dr. Jain that the coordination of care is such an important issue in this setting, because as a psychiatrist in the jail, we need to communicate with so many different types of staff, including correctional staff. That includes a DEC officer, a sergeant. Then we need to talk to the nursing staff. We need to talk to the hospital about what's going on with the patient, just to make sure that the patient would be appropriate for that type of care. And I think my conclusions from those types of situation is that making sure that we have, first of all, enough staff is very important, because when we don't have, when we have a missing link, even on one side, it creates a huge challenge or a barrier to access care for our patients. That becomes critical, because in this case, if somebody is in acute withdrawal and needs immediate care, and any delay could result in adverse outcomes, I think it just puts our patient in danger. And that's why in our jail, we always advocate for increasing the staff ratio for our inmates and for our clinics, and also the communication between the providers and the nursing staff, just to let them know what our concerns are about the patients. So then the nursing have more opportunity to be more alert to the needs of a particular patient, so they can channel, I guess, their resources a little bit more effectively.
Dr. Jain, any other strategies that you used in your situation of that particular case that come to mind?
One of the important things that came from that case was a reminder of preparing the correctional officer beforehand of what my role was, why I'm there, and what some things to anticipate in terms of if there's any emergency needs, how would the correctional officer intervene? How would I be able to seek help? So just being aware of the environment was that was a very important reminder in that case. And it also reminded me of, even if you're in a new situation with a new jail environment or new prison that you're working in, being familiar with what's happening in terms of available services, who to contact for those needs. That's also very important. And then the other piece was I was being very careful to be respectful of the correctional officer in their role. And also I was able to share just generally about this particular individual, that there might be some immediate psychiatric or medical needs, and that whatever the individual was doing was not volitional, that they actually needed some help. And the correctional officer really respected that I was able to share just kind of briefly about that while maintaining the privacy and confidentiality of some of the issues with the individual. But in those circumstances, it's important to kind of have that communication with the correctional officers and share what information we're able to share just to maintain that safety.
So generally, Dr. King, is there any advice you would give for providers who are working with individuals with serious mental illness in these environments for when they encounter some challenging situations?
I would echo also what Dr. Jain said, that communication with correctional staff is a key, because often they're not aware what's going on with inmates psychiatrically. And I think it always pays off when you let them know that we're really concerned about this particular inmate or patient. In addition, I think just to have, a list of patients that you're concerned with overall for the service, because typically, in this case, we pay more attention to certain inmates and we see them more regularly and more often to make sure that they are stable or they don't get worse. And the communication among providers, because as we know, often jails are not staffed on a daily basis with a reasonable amount of providers. And so I think when it's a weekend, it's only one provider. To keep the communication between providers about acute issues is very important as well.
Yeah, that's great to think about. Dr. Jain, any other words of advice?
I think along the same lines of being familiar with the environment and what staff are available, I certainly echo what Dr. King was mentioning about having good staff that have good training and awareness of what's happening in the environment. That's a very central piece of what we do in our correctional settings. And just being aware of the various policies that might be available in the settings. Each place has different unique situations. For example, how to report contraband is an important piece in correctional settings. We have to balance our role of maintaining our role as clinicians or evaluators if you're doing a forensic evaluation, while also being aware that we're mindful of safety in the correctional setting and security. And so each place may have unique policies about how to report that to the correctional side, and what can be reported, what should be reported, and how to balance those issues regarding safety in that environment.
That's great. And if I could just ask one quick thought on what draws you to the work, given the really incredible challenges and sticky situations you can face clinically.
I think for me, the correctional setting I work in it's in a way it's like a public health emergency room, because we see so many acute patients and clinically complicated and challenging patients that I just find this experience very rewarding from the clinical standpoint and also from the professional standpoint, because I have a very good exposure to great people and colleagues that I work with. And you can definitely see great results that our jail does and the care we provide. So just overall, it's humbling to be working with this type of population. And also it's just a great opportunity for the professional growth. And that's why I enjoy it very much.
Thank you. And Dr. Jain?
Yeah, I've had the privilege of working in different roles in correctional forensic settings, doing forensic examinations. I find that very rewarding, being able to answer a legal question for the courtroom and serve as an expert witness. And there's a lot of unique challenges with doing that work and understanding the legal and ethical nuances. And on the treatment side, I found it very rewarding working in areas where there's a great need for individuals who have severe mental illness and a lot of challenges in correctional settings. And although there are very sticky situations, as we're talking about right now, anticipating those, being prepared, I found that once I got through a lot of those anticipation of different challenges that might occur, it became even more rewarding being able to see the need in those settings and the ability to connect with someone who's really in a challenging situation themselves. So I found that very rewarding being able to serve in that capacity.
That's great. Well, I'm really grateful to both of you for imparting the knowledge you've acquired in your work with individuals with serious mental illness and correctional mental health practices in really complex environments. Your strategies and tips, such as fostering communication amongst providers and with correctional staff, monitoring and using your psychiatric expertise to communicate what the patient's needs are to people who may not understand it, were both excellent ways of trying to navigate those sticky situations and provide an excellent source of advice for listeners to bring back to their own workplaces and to inspire others to work in correctional mental health. So thank you again for your time and for your hard and diligent work with this population.